Obsessive thinking is a common phenomenon that many people experience at some point in their lives. It involves persistent, intrusive thoughts or images that cause significant distress or anxiety. These thoughts often feel uncontrollable and overwhelming, dominating a person's mind and interfering with their ability to focus on other tasks or activities. From a psychological perspective, obsessive thinking is often associated with obsessive-compulsive disorder (OCD), although it can occur in individuals without a formal diagnosis of OCD. These thoughts can vary widely in content, ranging from fears of contamination or harm to concerns about orderliness and symmetry. Regardless of the specific content, obsessive thoughts tend to be irrational and exaggerated, leading to heightened levels of anxiety and discomfort. One of the defining characteristics of obsessive thinking is the sense of urgency and importance that accompanies these thoughts. Individuals may feel compelled to engage in repetitive behaviors or mental rituals in an attempt to alleviate their anxiety or prevent a feared outcome. For example, someone who has obsessive thoughts about contamination may feel the need to wash their hands repeatedly, while someone with obsessive fears of harm may constantly check and recheck locks or appliances. Obsessive thinking can also have a profound impact on a person's emotional well-being, and the constant barrage of intrusive thoughts can lead to feelings of shame, guilt, and embarrassment, as individuals may worry that others will judge them for their irrational fears or behaviors. Additionally, the distress caused by obsessive thoughts can interfere with relationships, work, and daily functioning, making it difficult for individuals to enjoy life or pursue their goals. From a cognitive behavioral perspective, obsessive thinking is often fueled by maladaptive beliefs and cognitive distortions. These may include beliefs about the importance of controlling one's environment or thoughts, as well as irrational beliefs about the likelihood of negative outcomes occurring. For example, someone with obsessive fears of contamination may believe that if they do not wash their hands repeatedly, they will become seriously ill or harm others. Treatment for obsessive thinking typically involves a combination of therapy and medication. Cognitive behavioral therapy, BED, of one of the most effective approaches for addressing obsessive thoughts and behaviors. In CBT, individuals learn to identify and challenge their irrational beliefs and cognitive distortions, as well as develop coping strategies for managing anxiety and reducing the frequency and intensity of obsessive thoughts. In addition to therapy, medication may be prescribed to help alleviate symptoms of anxiety and depression associated with obsessive thinking. Selective serotonin reuptake inhibitors, OSSRIs, are commonly used to treat OCD and can be effective in reducing the frequency and severity of obsessive thoughts. Overall, obsessive thinking is a challenging and distressing experience that can significantly impact a person's life. However, with appropriate treatment and support, individuals can learn to manage their symptoms and regain control over their thoughts and behavior. Through therapy, medication, and self-care strategies, individuals can find relief from obsessive thinking and improve their overall quality of life. But the technique of solving this disease. One effective technique to address obsessive-compulsive thinking is cognitive behavioral therapy, (T). This therapeutic approach focuses on identifying and challenging irrational thoughts and behaviors associated with OCD. In CBT, individuals work with a therapist to understand the underlying beliefs driving their obsessions and compulsions. Through various techniques such as exposure and response prevention (ORP), individuals gradually confront feared situations or triggers while refraining from engaging in compulsive rituals. By repeatedly exposing themselves to these triggers without performing the compulsive behaviors, individuals learn that their feared outcomes are unlikely to occur, leading to a reduction in anxiety over time. Another practical technique is mindfulness-based interventions, such as mindfulness meditation and acceptance and commitment therapy. These approaches teach individuals to observe their thoughts and emotions without judgment, fostering a greater sense of acceptance and detachment from their obsessive thoughts. By cultivating mindfulness skills, individuals develop the ability to respond to their thoughts in a more adaptive and non-reactive manner, reducing the impact of obsessive thinking on their daily functioning. Additionally, lifestyle modifications such as regular exercise, adequate sleep, and stress management techniques can complement therapeutic interventions. Engaging in physical activity releases endorphins, which can improve mood and reduce anxiety, while prioritizing sleep hygiene promotes restful sleep and mental clarity. Incorporating relaxation techniques such as deep breathing exercises or progressive muscle relaxation can also help individuals calm their minds and reduce